Welcome, everyone. Today we will discuss a very important radiology topic, MRI of the hip. The hip joint carries the weight of our body and plays a vital role in every movement, from walking to everyday activities. That's why hip MRI is one of the most accurate and effective imaging techniques for diagnosing pain, injury, avascular necrosis, labral tears, or any other suspected pathology. In today's video, we will explore how hip MRI is performed, proper patient positioning, the essential sequences, key points to look for while reporting. So let's get started and learn everything about hip MRI in a simple, step-by-step way.
T1 TSE, Axial Planning. Plan the axial slices on the coronal plane and angle the positioning block parallel to both the right and left femoral heads. Check the positioning block in the other two planes. Ensure an appropriate angle is maintained in the sagittal plane, which should be perpendicular to the femur. The slices must be sufficient to cover the hip joints from the anterior superior iliac spine to 1 inch below the lesser trochanter. To minimize ghosting artifacts caused by peristalsis and breathing, consider using a saturation band over the axial block.
T1C Coronal Planning. Plan the coronal slices on the axial plane. Angle the positioning block parallel to the RT and LT femoral heads. Check the positioning block in the other two planes. An appropriate angle must be given in the sagittal plane, parallel to the femur. The slices should adequately encompass the hip joints, starting from the ischial tuberosities and extending up to the line of pubic symphysis. To minimize ghosting artifacts caused by peristalsis and breathing, consider using a saturation band over the coronal block.
T2 True Sagittal Planning. Plan the sagittal slices on the coronal plane. Angle the positioning block parallel to the femur. Check the positioning block in the other two planes. An appropriate angle must be given in the axial plane, perpendicular to the femoral head. Slices must be sufficient to cover the hip joint from outer cortex of the greater trochanter up to the inner portion of the acetabulum.